Hello, my name is Nawari McGowan, and this presentation is about improving health literacy with communication. Choosing a healthy lifestyle, understanding how to seek medical care, and taking advantage of preventative measures require that people understand and use health information. The ability to process, obtain, and understand health information needed to make informed health decisions is known as health literacy. The agenda of this presentation is to improve upon the use of preventative services. According to multiple studies, people with limited health literacy skills are more likely to skip important preventative measures such as flu shots, mammograms, and pap smears. When compared to those with adequate health literacy proficiency, studies have shown that patients with limited health literacy skills enter the healthcare system when they are sicker. Knowledge about medical conditions and treatments. People with limited health literacy skills are more likely to have chronic conditions and are less able to manage them successfully. Studies have found that patients with diabetes, high blood pressure, asthma, or HIV and AIDS who have limited health literacy skills have less knowledge of their illness and its management. Rates of hospitalization. Limited health literacy skills are linked with an increase in preventative hospital visits and admissions. Research has demonstrated a higher rate of hospitalization and use of emergency services among patients with limited health literacy skills. Health status. Studies have shown that people with limited health literacy skills are significantly more likely than persons with adequate health literacy skills to report their health as poor. Healthcare costs. People with limited health literacy proficiency make greater use of services designed to treat complications of disease and less use of services designed to prevent complications. Studies demonstrate a higher rate of hospitalization and use of emergency services among patients with limited health literacy skills, therefore creating a higher healthcare cost. Stigma and shame. Low health literacy can also have negative psychological effects. One study discovered that those with limited health literacy skills reported a sense of shame about their skill level. As a result, they may hide vocabulary or reading difficulties to maintain their dignity. Who's at risk? Populations most likely to experience low health literacy are racial and ethnic minorities, older adults, people with less than high school degree or GED certificate, people with low income levels, non-native speakers of English, and people with compromised health status. Education, language, culture, access to resources, and age are all factors that affect a person's health literacy skills. The next slide showcases my county's ratings and how many individuals may have low health literacy skills. Overall, San Bernardino County is ranked at 38 for California's health outcomes. What is happening and why is this campaign important? It is estimated that approximately 12% of adults have proficient health literacy, according to the National Assessment of Adult Literacy. This equates to nearly 9 out of 10 adults lacking the skills needed to manage their health and prevent disease. 14% of adults, that's about 30 million people, have below basic health literacy. These adults are more likely to report their health as poor at 42% and are more likely to lack health insurance at 28%, than adults with proficient health literacy. Low literacy has been associated with poor health outcomes such as higher rates of hospitalization and less frequent use of preventative services, both of which are linked with higher healthcare costs. With this information being provided, are limited health literacy and limited literacy the same problem? No, but they are interrelated. People's writing, reading, and number skills are only a part of health literacy. People do need to possess strong literacy and numeracy skills to make it easier to understand and use health information and services, but studies have shown that many health and healthcare activities are unfamiliar, complicated, and technical to most people. Health literacy is important for everyone because at some point in our lives, we all need to be able to understand, find, and use health information and services. Taking care of our health is part of everyday life, not just when we visit a clinic, doctor, or hospital. Health literacy can help us prevent health problems and protect our health, as well as better manage those problems and unexpected situations that occur. The change theory of nursing was created by Kurt Lewin. Lewin defines behavior in this model as a dynamic balance of forces working in opposing directions. Lewin's change theory is a great theoretical approach to the problem of health literacy because the concept it encourages are ideas that can be applied to multiple communication settings. This theory is simple and interchangeable to not only healthcare providers but also patients. The change theory has three key concepts: driving forces, restraining forces, and equilibrium. Driving forces involve factors that push in a direction that causes change to occur. They facilitate change due to the push for patients to go towards a desired direction, causing a shift in the equilibrium towards change. Restraining forces are factors that counter the driving forces by hindering change because they push the patient in the opposite direction. This leads to a shift in the equilibrium that opposes change. Equilibrium is a state of being where no change occurs due to the driving forces equaling restraining forces. This state of balance can be raised or lowered by changes that occur between the driving and restraining forces. My CSP project is about improving important communication between nurses and patients with the use of bedside reporting during change of shift. Incorporating this intervention will improve upon health literacy under the hospital setting. Using this theory to the problem of health literacy, the driving forces that have been identified are a decrease in hospital readmission rates and costs, improved communication awareness, and positive patient engagements that individualizes their treatment options with improved patient safeties. Other forces that have been identified are increased patient satisfaction, improved safety measures, increased nurse accountability, increased use of preventative services, and a better understanding of illness from the patient perspective. There are three stages comprised in this nursing theory: unfreezing, change, and refreezing. Unfreezing is a method which involves finding a process of making it possible for people to let go of an old habit that was somehow counterproductive. This is pertinent to overcome the strains of individual resistance and group conformity. Three methods were identified to lead to the achievement of unfreezing. First is to increase the driving forces that direct behavior away from the existing circumstance or status quo. Second, the restraining forces that negatively affect the movement from reaching the existing equilibrium needs to be decreased. The last step involves finding a combination of the first two methods. During this stage, providers need to be in tune with the way they communicate health concerns. This increases the driving force. The restraining force involves how much the patient understands. Therefore, providers must find ways to improve this. Gauging the knowledge of the patient and making appropriate accommodations to ensure full comprehension is a great combination of increasing the driving force while minimizing restraining forces. The change stage, which is also known as moving to a new level or movement, incorporates a process of change in thoughts, feelings, behavior, or all three that is in some way more liberating or more productive. An example of this is when providers consistently self-rate their care and communications. Providers who take the time to elaborate ideas and engage patients with education are prime candidates that facilitate change. Accomplishing this act alone achieves a balance that is more productive to increased health literacy and a permanent positive change. The refreezing stage is creating the change as a new pattern so that it now becomes the standard operating procedure. Without this final stage, it can be easy for participants to go back to old habits. This stage would involve the practitioner developing standards as the new normal. For example, when providers make it routine to quiz their patients on the education they just provided to ensure for comprehension, or when practitioners learn and provide their patients with language interpreters because they realize more information is revealed this way. Both methods reinforce the rephrasing stage and ultimately creates a happier balance between both patient and provider. To address the health issue of inadequate health literacy, my campaign will incorporate conducting free meetings with hospital organizations and professionals. These meetings will be catered to improving health communications between providers and patients to ensure that health information and services can be understood and used by all Americans. This campaign will engage participants in skill building with healthcare consumers and health professionals through the use of adult educators and tools such as animations, fact sheets, and informative posters. Using different platforms to get the message of health literacy across helps individuals with different learning techniques. For many people, visuals are a preferred style, especially for technical and confusing information. Health information can overwhelm even persons with advanced literacy skills. Medical science progresses rapidly. What individuals may have learned about health or biology during their school years often becomes outdated or forgotten, or is it incomplete. Moreover, health information provided in a stressful or unfamiliar situation is unlikely to be retained. Therefore, an approach towards health literacy is a must to secure a better health outcome for all. This slide is showcasing the poster I made that helps one achieve proper communications. I also provided an infographic from the National Institutes of Health and the CDC that covers good communication skills with health literacy as an additional resource. And here are my references. Thank you for watching.